Hello, I'm Dr. Bannan. Thank you for your interest in our practice and for considering us for cataract surgery. Please know that if you elect to move forward, my staff and I will do everything we can to get you a great outcome. I wanted to make this video as a general overview regarding cataract surgery. It's not meant to answer all of your questions. We'll certainly do that the day that you come in for your evaluation. First of all, what is a cataract? A cataract is the term we use to describe the lens of your eye that's lost its transparency. Cataract surgery is one of the most commonly performed operations in the United States. At the time of cataract surgery, we take the cloudy lens out of the patient's eye and we replace it with a transparent artificial lens implant. We numb your eye very thoroughly before we do this, and we put medicine in an intravenous to help relax you. Most patients report to me they don't see or feel anything during the surgery. In my hands, this is about a 10 to 15 minute procedure. We don't use stitches, patches, or needles, and most patients can resume their normal activities the next day. Modern day cataract surgery has a success rate of over 99%, but it is real surgery and it carries some of the risks of surgery. The chance of having a vision-threatening complication from cataract surgery is less than 1 in 1,000, however. So it's generally considered a safe procedure. Once you decide whether or not you wish to have cataract surgery, you may have an option as to which technique I use to remove your cataract. For the purposes of this discussion, let's describe these techniques as the old way and the new way. The old way is also called traditional cataract surgery. With traditional cataract surgery, the surgeon uses his or her hands and a scalpel and some other instruments to do all the steps they need to do to take out the cloudy lens and put in the lens implant. Traditional cataract surgery works very well. I've done 30,000 of them. And the best advantage of the traditional cataract surgery is that it is paid for completely by your major medical insurance, less any copay or deductible. The newer technique is called laser-assisted cataract surgery. With laser-assisted cataract surgery, the surgeon uses a laser attached to a computer, and we use this device to automate several steps of the surgical procedure. Things that used to be done by hand are now done by a machine, so it's quicker, more accurate, and perhaps somewhat safer. The greatest advantage of the laser, in my mind, is that it can soften up the cataract inside your eye before we remove it. This makes for a more gentle cataract surgery, which is always a good thing. The laser can also reduce or eliminate low and moderate amounts of astigmatism. The laser constructs a three-dimensional image of your eye prior to the treatment, so in essence, it's customizing the surgery to your eye. It's great technology, and if I could, I would do laser-assisted cataract surgery on everybody. Not everybody's a candidate for laser, however, and it's important to point out that part of the cost of the laser treatment is not paid for by the patient's insurance. This extra out-of-pocket expense is bothersome to some patients, and we understand that. We at least want you to know we have laser-assisted cataract surgery here and ask you to consider it. Once you decide which technique you want me to employ, you may have a choice as to what type of lens implant I put in your eye. If you get traditional cataract surgery, we can only do the standard monofocal lens implant, which is a very good implant. This implant will quite frequently get you good distance vision without glasses, but in some cases it might be necessary to fine-tune your vision with glasses. Actually, that applies no matter what type of implant you choose. But in general, the monofocal lens implant will get you good distance vision without glasses. If you have astigmatism, you may be a candidate for a toric or an astigmatism correcting lens implant. And we also have the extended depth of focus lens implant here, which gets the patient good distance, good intermediate, and some up-close vision. It doesn't make you see like you did when you were 20, but it definitely gives you more up-close vision than the standard monofocal implant. Again, not everybody's a candidate for the EDF implant. We'll make that determination the day that you come in for your visit. Well, those are some general principles and some things that I'll ask you to think about. We'll talk in great detail about your particular eye care needs when you come to my practice for your evaluation. If you want more information about cataract surgery or the other services that we offer here at our practice, you can go to our website. The address is www.bannaneye.com, and Bannan is spelled B-A-N-N-A-N. Once again, thank you for your interest in our practice. We will do as good a job as we can taking care of you, and I look forward to meeting you in person.